From Italy, the TNT conference on thyroid ablation. We're seated with Dr. Sinclair from Melbourne, Australia, but you lived in New York for 11 years.
I did. I worked at Mount Sinai in New York for 11 years and moved back to Australia in 2021.
So recently relocated back to Melbourne.
Indeed.
A city I love for all the croissants and coffee.
They have great coffee and great croissants, although I must say Italy, I think, is a very high contender for those things.
For sure, along with the gelato.
Yeah. We cannot claim to have better gelati in Melbourne, no.
Dr. Sinclair, can you tell us a little bit more about your expertise, what you're focusing on right now and where?
Absolutely. So I'm a head and neck surgeon. I have dual fellowships in head and neck surgery, thyroid surgery, in addition to laryngology, so the voice and the voice box. And so it's that dual role that sort of led me into thyroid surgery in the first place, because the vocal nerves are at risk during thyroid procedures, including during ablation as well as surgery. And that's been a sort of, alley of research for me over the past 11 years as well.
It's an important issue, protecting the laryngeal nerve and the nerves, vital nerves in that area when you're doing an ablation.
Absolutely. So the thyroid sits in a very small bed, I guess, surrounded by very critical structures, and the laryngeal nerves are probably, I would say, in my experience as a surgeon, the structure that patients are most fearful of being injured during surgery, but also during ablation. And definitely a lot of patients come to me for ablation because they want to avoid surgery. They may be a singer, they may be a professional voice user, and they want to avoid surgery because of concern about those nerves. And I guess it's my role and the role of people who perform ablation to make sure people are properly educated about the risks to those structures and the strategies that we use to help ensure that those structures are not damaged during ablation.
And it shouldn't happen, but because there's so much technology now to protect that area. However, that technology is not used by every doctor, correct?
Correct. So in surgery we have nerve monitoring, which has really changed not the way we do thyroid surgery, but has definitely given us a mechanism to monitor those nerves and protect those nerves. Because we do ablation when people are awake, not under general anesthesia, we don't have the ability to monitor the nerves in the same way. And so it's that avenue that's currently an area of research, I guess, trying to work out how can we protect the nerves when someone is awake, and we can't use that nerve monitoring technology that we might use during surgery. So I think it's important for people to know that with ablation, the nerves are at risk, and although perhaps the risk is slightly less than with surgery, it still is a risk, and there are strategies we use to try and minimize that risk, but it's not a given that injury doesn't happen.
Okay, how can a patient be prepared and know that his or her nerves area is being protected during either thyroidectomy or even ablation? What questions should they be asking?
Absolutely. So I think there's been a lot of studies looking definitely in the surgical literature more than in the ablation literature, but it follows suit that they would be similar given they're both procedures, that the more experience the proceduralist has, be it the surgeon or the person performing the ablation, the less likely there are to be complications of all sorts, but obviously nerve injury being one of those. And so definitely the experience of the person performing the ablation, how many ablations that person has performed, questions specific to complications that you are worried about. So questions pertaining to your voice or pertaining to your swallowing. It's important to ask these questions before the procedure, because sometimes people have symptoms that they are convinced is due to their thyroid nodule that may not be, and it's important to have those symptoms properly investigated before you decide to proceed with a procedure that may or may not cure those symptoms.
Should a patient assume that every doctor is using, say, a nerve monitor?
So in ablation we don't use nerve monitoring because you really need to be under general anesthesia for that, and I did a very early on in my ablation experience in New York, I did a series of patients under general anesthesia where we did use nerve monitoring, and it showed that nerve potentials remain pretty stable as long as you use lower energy at the back of the thyroid gland where the nerves run, and as long as you minimize the time spent in those areas so that you pull the electrode back fairly quickly from those areas. And it seems by doing that, using low powers and minimizing the time you spend in those critical zones, you can pretty much prevent nerve injury in most cases.
Okay. Great. Kathy, go ahead.
Oh, sorry. Yes.
Maybe slide this back. Yeah. Okay, I just noticed it was.
Sorry.
Okay, it's okay. This is all great information. I think for some patients, they don't realize what goes into, say, a thyroidectomy, and that, in fact, their vocal cord could be at risk. So ideally, it'd be great to avoid surgery.
Absolutely.
And if ablation is possible, that would be ideal.
Absolutely, and I think that's where ablation, it opens a door, I guess, for alternative treatments to surgery. I would say that it's important that if you do have a hoarse voice or any voice concerns prior to ablation, that needs to be properly assessed. I've had one patient who actually ended up having a vocal fold paralysis on the side opposite to the side we were planning to ablate, that if I hadn't looked at her vocal folds, we wouldn't have identified. And I guess a strategy that I now use, which with pretty much all patients, is I have patients actively count while I'm ablating at the back of the thyroid near the nerves. We're lucky because our voice we can hear, and if someone's nerve is affected by heat during ablation, you can hear the voice change. And in the 2 cases of hoarseness I've had during ablation, both patients' voices were hoarse immediately at the time of the procedure. And so by having people count in a very monotonal way while I'm ablating, not in between runs of ablation where you may actually miss the injury happening, that while I'm ablating, I haven't had any nerve issues since I started doing that. And I think that it is an important protective mechanism to listen to the voice in real time as a way of trying to mitigate any heat transferred to those nerves.
And in Australia, how common is thyroid ablation?
So until a couple of months ago, I was the only person performing ablations in Australia. There's now one colleague who has just started in Western Australia, but still that would only be 2 of us. I've been doing them there since 2021. People want ablation, they know about ablation, they know it's happening overseas, and it's only a matter of time before it's more available in Australia. I ablate in Melbourne and Sydney, just trying to cover a little bit of that east coast, but Australia's a big country, and gradually more and more physicians will take it up. And my main goal is to make sure that that's done safely, and that the physicians taking it up have the skills to actually be able to perform the procedure safely. So good ultrasound skills, good interventional biopsy skills, and a knowledge of neck anatomy and critical structures that can be injured during ablation and how to assess them and ameliorate that.
Before we say farewell from Italy, any final thoughts you would like to share with those watching or listening about protecting the laryngeal nerve during either ablation or thyroidectomy?
So I think having realistic expectations and knowing that injury can happen despite the best protective mechanisms, but knowing that experience of the proceduralist performing the ablation does help lessen complications. Knowing that there are strategies we can use to try and lessen the chance that nerves are injured, and just having an idea of what questions to ask your proceduralist when you go inquiring about ablation. I think these are all very important points that people should think about before heading down the ablation path.
If somebody's watching, how can they reach you if they're interested in getting in touch?
Absolutely. So email is probably best, and I get a lot of emails from people internationally as well as within Australia. Catherine at melbournethyroidsurgery.com.au.
Great.
Wonderful.
Nice to see you.
Lovely to see you. Thank you so much.
See you, everyone.